Good afternoon and welcome to our third session of our ADA seminar. We'll just give a few minutes for everybody to get on before we begin. Well, welcome and hello to the third session of the Ability Center's 5th annual ADA seminar, which we put on every year with our partners, the Toledo Lucas County Commission on Disabilities and TFA. The seminar this year is Creating Transit Access from Government to Grassroots. And for those who missed the first two sessions, we encourage you to visit our website for the seminar to check them out. This year we are focused on best practices in public transit for people with disabilities. And this session is going to be a panel on transit access by local disability advocates. Just a couple things before we get started. We encourage everyone who's attending to check out our seminar website, attend the remaining sessions. There are this session and one more, and then also join our ADA coordinator email list. We do have closed captions available. There should be a transcript. The bottom of the screen on that, the closed captions. Finally, we ask or invite everyone who attends these seminars also check out our ADA coordinator library on our website. And that's something that we can send a link out to folks. It has a lot of resources for people interested in ADA access, including resources about ADA transition planning and other issues facing disabilities. With that, I'm going to turn this over to Vera Mendoza, who is the Disability Rights Advocate in Housing and Transportation for the Ability Center, to introduce our moderator. Go ahead, Vera.
Thank you, Katie, for introducing me. My name is Vera Mendoza. I am a disability rights advocate at the Ability Center. I have the pleasure of introducing Shelley, who many of you may know if you are familiar with the work of the Ability Center. Shelley is currently at the Toledo Museum of Art. She is the very first manager of access initiatives. And already is helping shift culture, and there's already articles posing the question, can an Ohio museum become the country's most accessible institution? So we are very excited for her work. We're very excited for her wisdom, and she will be your moderator today. I will pass it on to you, Shelley.
Thank you so much, Vera. I really appreciate that warm introduction. Hi, everyone. My name is Shelley, and as Vera said, I am the manager of access initiatives at the Toledo Museum of Art. I am also a strong proponent for public transportation as a public transit user myself, so I'm so excited to be here today and to be moderating this panel. We are going to go ahead and get started and have our panelists introduce themselves. So I'll just call out panelists, I'll call out your names and you can give a brief introduction of yourselves. The first person I see is JoRita Fox. Would you like to give an introduction?
Hello, my name's JoRita Fox, and I'm Secretary of Salute Advocacy Group, an advisor to People First, and I've been a long time member of CATER, which stands for Community Advocates for Transportation Reform, and I'm also Vice President of the State ARC.
Great, thank you, JoRita. Next person I see is Lauren. Would you like to introduce yourself?
Absolutely. My name is Lauren Notestine. My husband and I live in Toledo, Ohio. We are long-term TARPS passengers. I am also a speech and language pathologist. I have cerebral palsy and I am also left eye blind. I depend on TARPS for transportation to work and to social functions.
Great, thank you, Lauren. Next, I see Kim Baker.
Good afternoon. Kim Baker. My professional life, I work with Toledo City Council doing policy work. So I've been able to look at some of these issues from a professional perspective, but that's not why I'm here on the panel. I've got 4 adult children, 3 of them with transportation issues. 2 have an inherited retina condition. My father had the same condition. He was legally blind by the time he was in his 30s. So I have one, my 21-year-old is a non-driver, has always been, and we anticipate my older son will also get to that point. And I also have an adult son who's epileptic. So he has intermittent transportation issues. So as the parent of children who are experiencing these kinds of challenges, just helping them navigate through deciding things like, where do I live? Where do I work? How does this work with transportation? Kind of an all hands on deck approach we take with our family. But that's my experience and who I am. Thank you.
Great. Thank you, Kim. And last but not least, Nathan.
Thanks, Katie. Hi, everyone. My name is Nathan Turner. I sit on the Lucas County Board of Developmental Disabilities, and I'm also a longtime friend of the Ability Center at Cater. And through that work, they've asked me to sit on the TARDA Next Committee, helping with the comprehensive operational analysis.
Great. Thank you, Nathan. So we'll jump right into the questions. The first question I have for you all is, what has been your experience with public transportation in our region? JoRita, would you like to start us off?
Okay. I came to Toledo in '81, and because I have cerebral palsy and complex partial epilepsy, I couldn't drive. So I relied exclusively on public transportation. And I found that I was terrified at first even to ride the buses, but I eventually learned my way into the system. I found the drivers to be very, very friendly, and they were very helpful in answering questions and making sure that I knew where I was going and what buses to take. And they looked out for me because, as an example, when I did a lot of volunteer work, and the morning bus I took was full of school kids, every morning, without fail, I'd get on the bus and the driver would say, "Would somebody get up and let that lady sit down?" It did make me feel like grandma, but I was very, very thankful for the concern and consideration that he showed.
Great. Thank you, JoRita. Nathan, do you want to go next?
Yeah, I'd be happy to. So my experience with public transportation here is a bit unique because I actually live in the Springfield Township area, which is not served by TARDA or TARPS. So I don't have a lot of experience or really any experience on either of those systems, but I have used public transportation in other areas throughout the state that have a funding stream that allows the public transportation to go throughout the county. So if this issue is important to you, please consider issue 12 in the fall and supporting it.
Thanks, Nathan. Lauren, do you want to go next? Lauren, you're muted.
Okay. Sorry about that. Yes, I encounter transportation issues every day. I work outside the home every day, except for a couple of days. And I depend on TARPS for transportation, and TARPS has been outsourcing to outside companies such as Black and White Cab or M&M. So I may get a call the night before my transportation is set to say, your morning transportation will be with whoever it is with. And that that's kind of frustrating to me because they're still late picking me up for work, and it's just frustrating. And I get very nervous when it comes to situations of being late or situations that are unexpected. When I first started taking TARPs was when I originally lost the vision in my left eye. I used to drive, and so going from being able to drive and depend on myself to waiting for rides and depending on other people, that was the toughest transition for me. But I just go with the flow and try to be flexible as much as I can. And it's when it affects my timeliness for work or timeliness for things that people are depending on me for, where the frustration comes in. So TARPS is critically important to accessibility to life.
Definitely. Thank you, Lauren. And last, Kim, would you like to?
Sure. My experience obviously is through my sons. I guess it's something that you can't truly even prepare for. So when my kids were small, we knew that this would be coming. So we always prepared. We went to, like Nathan, we went to other cities and always took public transportation when we visited. And we did this frequently because I wanted them to be comfortable using a public transportation system, knowing that that's what they were probably going to rely on when they grew up. But in practice on a day-to-day, that's a whole different thing in this area. Again, we are also like Nathan, we live outside of the service area. We live in Swanton. And I've kind of always told my kids, you need to really think about probably living in the city. It's just the way your life is going to need to be so that you can get to work and you can do those things. So my younger son now, he actually moved in with my other son. He lives with my two sons live together. And he works in the service industry. So on the front end, he's got to prepare, probably 2 hours to get himself to work if he would take the bus, which he can do that. But he often gets off after 9 p.m. So there is not a bus option for him to return home. So he ends up relying, if we are not able to get him, he relies on Uber. At his salary, that's a huge chunk out of his paycheck to do that. And I'll say this, on the weekend of Solheim, we were not able to take him, and it cost him $100 to get to and from work. I mean, that was significant. With Uber, you're relying on surge pricing. So that's not normal, but it's just kind of the things that you can't anticipate, right? You don't know for sure what you're going to experience on any given day. So I think it's the uncertainty of every day that's probably the most challenging. And we're lucky that we have, as parents, have the flexibility often to help. But I know not everyone has that luxury. So
Great. Thank you all. And some of your answers actually lead into the next question. Or what? I'm sorry, I skipped over a question. So we'll come back to that. But some of you also answered this. What public transportation companies do you use? Is there anyone who would like to take that first? Lauren, do you want to go ahead?
Sure. Primarily TARPs. When TARPs is not able to accommodate black and white, or M&M, or sometimes black and white cab for a going to work trip and M&M cab to come home. Get a little mixed up with that. There was a time that I called black and white waiting for my transportation to go home from work, and they said, "We don't have you on the schedule." Then I remembered it's M&M that was supposed to take me home. So that was quite a tricky situation there, but I just have to breathe and take it day by day. For medical transportation, I use TLC and Citywide.
Great. Thank you, Lauren.
Thank you.
Nathan, do you want to go next?
Yeah, I'd be happy to. And I want to say something about Lauren's experience in terms of just having to wait on the cab and navigating all of the different transportation providers. It just underscores how much we as people with disabilities spend in our lives waiting for service providers to pick us up. That's just not a very efficient way to do things. And it leads into my response because I have had some experience with not so much public transportation in terms of TARPs and TARTA, but I have had experience with waiver providers helping with transportation because I am outside of the TARPs and TARTA service area, but I still end up waiting for them because of staffing levels or routes or whatever. So I had to use my ABLE account and use funds in my ABLE account to purchase an accessible vehicle to be able to access my community.
Great. Thank you, Nathan. Kim, do you want to go next?
Don't really have much to elaborate on,
Okay.
except I guess, our approach is always, and especially with my epileptic son. So he's kind of, most of the time he's fine. He may go a year and then all of a sudden, surprise, now he's not driving for 6 months. So then we have to put kind of a family plan in place to get him to and fro. And he is one who lives outside of the service area. So,
Right.
we take turns, we do our best. But relying on the bus and Uber, and we have done a black and white contract at different times. Those are mainly that's our approach.
Great, thank you. And JoRita? Oh, JoRita, you're on mute.
Okay. 90% of the time I've been here in Toledo, I've used TARTA. But I became a TARPS rider, and now I would need to ride TARPS almost exclusively because I'm recovering from a broken femur. And it's taken a little bit of time. So I ride TARPS. Of course, I live in Holland also. So we don't get service out here. But if I was able to ride, I'd be riding TARTA, or not TARTA, but TARPS.
Great.
Because of my...
Oh, go ahead, JoRita, sorry.
No, I was just going to say because of my physical mobility issues at the moment, I'd be riding TARPS.
Great, thank you. And some of you have touched on this question, but if you have anything to elaborate on, please do. What has been your biggest challenge based on the public transit that is available?
I'd like to start with that one. Because of my job, I'm a contracted speech and language pathologist to various locations. I've had to tell my company, no, I cannot service that location because TARPS doesn't go there. Or most of my doctors and medical professionals are in Oregon. So I have to use alternate forms of transportation or depend on friends. Family lives out of state, so that doesn't help. It's just a very frustrating situation. I've even said to my husband, I'll just walk there. And he'll say, no, did you forget about the hill on Wheeling? Yeah, I kind of did. My vision is to the destination and not always to the process, to my detriment. So I would say that that's my biggest challenge, is just trying to navigate everything that is expected of me and required of me with my health needs and with my professional obligations, and just things I want to do for fun. I have to call a friend and say, are you going to here? Can I go with you? And that's a very humbling situation, especially coming from, I used to be able to drive,
Right.
and I no longer drive. And my husband does not drive either. So I'm not about to jeopardize my life or somebody else's life just because of my pride. I'm going to be the one to drive myself everywhere. No, that won't happen.
Right. Anybody else?
Having to tell my company no, or having to deny people help that I could possibly be helping because TARPS doesn't go there. That, among with the other things that I mentioned, is just the most frustrating part.
For sure. Thank you, Lauren. Does anybody else want to elaborate on that? Nathan?
I just want to say, in line with what Lauren was saying, I have a saying that I use. Transportation is a lifeline for people with disabilities, but it's also a lifeline for the strongest communities, because anyone can become a person with a disability at any time. So when we're thinking about investments in transit, this is what we're talking about. We're talking about equity, we're talking about healthcare, we're talking about education, we're talking about access. It's all interrelated. And to your question, when I used public transportation outside of this area, my biggest challenges were timeliness of service and the availability of routes.
Yeah. Great. JoRita, do you want to go?
Yes. One of my challenges has been that at some point in time, my balance went on vacation and never returned. So I would have problems navigating the steps, trying to get on TARPs. But the other thing is, riding TARPs, they have a rule that they can come 10 minutes early to 20 minutes late. And they always encouraged you to make a reservation an hour before you had to be at your destination. Well, if they come 20 minutes late and you have to be somewhere at a certain time, and there's several people on the bus that they have to take home or pick up before they get to you, you don't know if you're going to get there or not on time. So I've learned to make reservations early. Like, for example, if I had to be somewhere at 10 o'clock, I may make a reservation for 8:30. Mm-hmm. However, on the flip side, I went to MCO. They took me to MCO one time. Mm-hmm. And when my pickup time came, I was still in the exam room.
Oh, no.
And I called them and told them that I was still in the exam room. The doctor wasn't finished with me yet. So they told me just to call when I got done, and they would come pick me up. And they did. And the other thing that happened was at some point in time when the restaurants began to open up, one day I went to Tim Hortons to get some coffee, read my nook. They came and told me that they closed the dining room at 3. My reservation to be picked up was at 4. So I called them and I told them what was going on. And of course I had to leave the restaurant, and I went outside and sat at the bus stop, and the next thing I knew, I was looking up at a TARP driver saying, okay, the bus is here. I can take you home. So they do try to accommodate people as much as they possibly can.
Yes. Thank you, JoRita. And Kim, do you want to add to that as well?
Yeah, just these are all great examples. I appreciate all of these because I can, I can relate to a little bit of what everyone is saying. And I think that the key thing, the system has to be simple enough to pick up and understand on a quick basis. Because, as Nathan said, anyone can become disabled at any time. That's my son, my epileptic son. Anytime, we don't know when it's going to be, what day, but I can guarantee it's going to happen again, right? And he's going to have to figure out his transportation. It needs to be easy for him to understand. But also people that are on varying schedules. So like my other son works at Dave & Buster's, so one day, like today, he works 12 to 5. So I left work, I took him to work, but there are many nights where I will go home. Again, I live in Swanton, so go home late at night. And this is a little bit like JoRita's story. He will get off, and simple for him is just order up an Uber tonight, Preston. I'm going to go home. It's late, right? So I go home, and I am worried to death that he's not going to get a driver to pick him up, because that has happened, right? So he's in Toledo, it's midnight, he's off work, and he's waiting and may or may not get an Uber driver, so you just, these varying schedules. It's one thing if you work a regular schedule and you can figure out the bus route and you get your timing down just right, you plan enough ahead, like JoRita said, so you get there, you got all of this worked out. But when your schedule changes every day, or when, sometimes you're okay to drive, sometimes you're not, and you got to be able to jump back in that system and figure out how to make it work on that particular day. I think that's probably some of the biggest challenges.
For sure. Thank you all so much for sharing that. The next question, and I might start with the people who live outside of our local public transit service area, is, has lack of public transit ever stood in the way of doing something you wanted to do? Nathan, did you want to start with that?
Unequivocally, I would say yes, it has. Even though I have an accessible vehicle now, that's still an expense, and it's out of reach for many. So in many cases, you're going to be dependent on either a natural support or a community support to get to where you need to go. And without that, as I said, transportation is access, transportation is employment, transportation is healthcare, transportation is connecting to the community. But even for the staff people that support people with disabilities, transportation is a lifeline for them too, because a lot of them depend on public transit to be able to serve individuals in the community. And that exacerbates the direct care crisis that's going on right now with a limited availability of caregivers. And it just, so much of our life depends upon the logistics of people getting to where they need to go. And that means everyone having an equal opportunity to access transportation services to get to where they need to go and do what they want and pursue their dreams.
Great. Thank you. JoRita, would you like to go next? You're on mute.
Okay. Naming places that I could go if there was transportation there. One of the things that I could do is, I'm on the Camp Courageous board, and periodically we have a meeting at Camp Courageous in White House. Guess where the bus doesn't go? So I have to depend on someone else from the board to get me there. And that can be very tricky at times. But I've also volunteered with the Epilepsy Center for their PGT, and they've had that at Levis Commons. And since we don't have very limited service in Perrysburg. That's been sort of awkward getting there. But it's just been very tricky getting to places like that, because you want to go somewhere and maybe the bus doesn't go there, and it's frustrating to ask for somebody to take you there, because friends, relatives, I don't have family here, but friends might be busy working, and it's not always possible for them to fill the gap.
Right. Lauren, did you want to speak to how lack of public transportation might have ever stood in the way of you doing something you wanted to do? You're on mute, Lauren.
If the event or the activity or whatever we wanted to go to, a concert or anything like that, was outside the service area, we have to depend on friends or family to take us to the location. I can remember specifically when my sister-in-law got married, her wedding was down the street from Ann Grady. Tarps stopped transporting at Ann Grady. They dropped us off, and then family had to load my husband's electric wheelchair onto the truck and get him into the truck, the family truck, to get us to the wedding, and then back to Ann Grady to be transported back home. And going to an event or a concert and having to leave the concert before the person you want to see gets on stage, because the bus is coming soon message comes through, and after 5 minutes they leave. It's a very emotional situation for me, because I've waited for the bus for over an hour before, but after 5 minutes they're allowed to leave. It's all about accessibility. Most of my doctors are in Oregon. TARPS doesn't go there. Hopefully, the service area will be expanded so that I can get to where I need to go, no matter where it is.
Great. Thank you, Lauren. And Kim, has lack of public transit ever stood in the way for your sons of doing something that they wanted to do?
We just had a conversation when I was taking Preston to work today. He told me, if you guys know what Magic the Gathering is, it's this card game, right? And he just told me, he said, Mom, I got some new Magic the Gathering cards. I said, oh, that's wonderful. I said, have you found somewhere to go play them, someone to play with? And immediately in my mind, the first thing I'm going is, oh my gosh, how's he going to get there? I mean, he can find somewhere to go. There are places where people gather to play these games, and he's done it before. But then, okay, that means that, Tom or I are going to have to be available at that time of night to go pick him up when this is over and get him back to where he's living. And, it shouldn't have to be that way. And all of this is, listening to Justice this morning too, she brought up some things that really kind of sat with me. Like, you always kind of think like, okay, yes, we're entitled to be able to get to our doctor's appointments and go to work, but we also should be able to do fun things, right? Like that shouldn't be such a challenge to be able to go to a concert and see the band that you want to see, or to be able to go play Magic the Gathering. And my other son also, because I said earlier, we kind of have raised the kids like, you're going to have to live somewhere where you've got all of this available to you. And my epileptic son, he said, Mom, he still lives out in Swan. And he's like, well, Mom, he's like, I just don't think it's fair. He said, I like where I live. I have a wonderful landlord. I can afford it. If I pick some other house, it's going to cost me more money. I just don't think it's fair that I have to live somewhere else because of this situation. And I thought, that's right. That's right. It's not easy. There's not a good answer, but I think that's right. Everyone's entitled to these things, and we do have to make choices or leave early, or all of these things impacting what we get to do for our quality of life overall, not just work and medical appointments. So I think that's something important to keep in mind. I've learned that through the process.
Yes. Thank you so much for sharing that, Kim. And so this has already also been touched on, but I'm going to ask you all this question as well. Are there any areas of our region where you wish public transit was more available? Nathan, go.
I wish public transportation was available universally throughout our region. And really, I think it should be feasible for someone, to start their day in Toledo and attend something in Columbus on public transportation, or Cincinnati. It should be that comprehensive, because the best cities have really strong transportation systems. And for Toledo to emerge in the post-pandemic environment and really be competitive, we have to have a transportation system that accommodates the needs of the community.
Great. Thank you, Nathan. Kim, do you want to go next?
I completely agree with Nathan. And also just to be able to interconnect better, even within the service area. Like to get, I guess I don't know for sure how the apps work, but we were in DC over the weekend, and we just got so spoiled with the system. Like it was so easy from, you need to walk 2 minutes to get to this, and they incorporate every piece of their transportation system into that app and tell you right how to get from one point to another. So I think even that, just a better, simpler way to connect all the pieces even within the service area would be great. But yes, for sure, regionally would be amazing.
Yes. JoRita, do you want to go next?
When I first read this question, my first thought was it must have been written with me in mind. Of course, living in Holland, I wish that the bus would come here to my address. I'm living at Astor House Assisted Living, and I have to depend on my friends once again to take me places. And I've also found an alternative for the moment. It's called Round Town, and it's sponsored by AAA, but they do not have as long a service hours as TARPS does. And you have to go when they are available, as opposed to TARPS that tries very hard to accommodate when you would like to go. And it would just be a lot easier for me to improve my independence and my well-being if I knew I could pick up the phone and make a TARPS reservation. And I called TARPS this morning just to ask them a question. The closest they would come to my address would be Kohl's on Holland Sylvania Road. And they said that was 2 miles away. Well, there's no way I'm going to be able to get to Kohl's to pick up a TARPS bus. And there's nobody available to take me there or to pick me up.
Right. Thank you, JoRita. And Lauren, do you want to finish off that question? Are there any areas you wish public transit were more available?
Absolutely. Definitely Oregon.
where we live, on one side of the street is Toledo, across the street, it's Oregon. In other places, I would say Northwood. I once had a location for work that I had to go to, and I had to have the owner of the work of the location pick me up and pick me up from the carryout and take me down the street where the location was, and then back to the carryout for tarps. It's awkward when you have to rearrange your life because your access is limited. And that's how I feel sometimes. And it's very frustrating.
For sure. Thank you, Lauren. So thinking of all of this and all that we have discussed throughout our panel discussion today, what would be your vision for public transit in the Toledo region? Does anybody want to take that first? JoRita, would you like to go?
Okay. Can you hear me?
Yes.
Okay. I would like to see, first of all, the sales tax passed, because then TARTA would get more money and they would have more money for new buses, for the many things that they need and want to do. Secondly of all, I'd like to see a larger service area, a county-wide service area, where people could take the bus, people that work, people that go to the doctor, people that want to use it for recreation, and not have to worry about how they're going to get somewhere. And lastly, if these two things would come to pass, I think a lot more people would give TARTA positive feedback. And I think we all know that most people, when asked about TARTA, they talk about the negative things. And I'm sure that the people that work for TARTA get frustrated when they never hear anything positive. And I think if these things could come to fruition, that people would have more positive things to say about public transportation. And it would be helpful and uplift everybody to feel that we were more satisfied with the public transportation system that we have, which hasn't happened for a good long time.
Thank you, JoRita. Lauren, would you like to talk to us about your vision for public transit in the Toledo region?
Sure. First of all, I think the process for qualifying for TARP's transportation needs to be more streamlined. The last time that we went through the interview process for TARPs, they said, we don't base it on the disability anymore. This is a service for people with disabilities. If you don't base it on the qualifying on the disability, then what do you base it on? That would be one thing I think needs to be streamlined, and also expansion of the service area so that you don't have to worry about, oh, I can't go to my doctor because TARPS doesn't go there, or I can't go to an event that I want to go to because TARPS doesn't go there. Just to be able to say, here's what I want to do. here's where I want to go, and have the transportation be streamlined and set so that there are no glitches. They need more drivers, and I understand that. They need better working buses, and I understand that too. But if they could just step into our shoes for just a minute to see what we go through just to accomplish what we need to accomplish in a day, just make it more streamlined and easier and have it make sense. When I see TARPS buses sitting on the side of the road, oh, because they don't have transportation, but I've been waiting for an hour. Oh, but that's not your bus. It doesn't make sense to me. The system should make sense. The access should make sense. The service area should make sense. And what would they want for their family?
Right. Thank you, Lauren. Kim, what would your vision for transportation in the Toledo region be?
I would like to see, obviously, you know, covering the whole region, that's just baseline critical, but also just more flexibility. You know, the fixed route thing is fine, but I think we need a lot more flexible systems. And just even hearing that story about the TARPS bus, like maybe partnering more or getting more on kind of the ride share model where it is more flexible. There's no need to sit and wait if there's someone who needs a ride. And how do you connect that from a technology basis? And how do you make it such that people can understand it and use it better, but not have to be waiting for 2 hours or have, you know, that end of I got off the bus and I'm still 2 miles from where I need to go. You know, how making it, you know, somehow flexible. Other companies have figured it out. It seems like it's possible to do in this area as well. And maybe that's with more partnerships, maybe it's with different equipment. But I think that we really need to think outside the box in order to make it, in addition to making it affordable, you know, with having these partnerships, because this will benefit everyone, not just people with disabilities. If we can make this transportation system work, it opens doors for everyone. So I think that kind of thing is what I would be looking for.
Great, thank you. And lastly, Nathan, what would your vision be for public transit in our area?
So I think passing issue 12 is definitely a start, but I think that would essentially enable us to get to what amounts to a bare minimum. I think my aspirational vision for transportation in the region is that all of our providers, whether they're TARPS and TARTA, which obviously they should be the bedrock as the main community provider, but also TARPS and TARTA, waiver providers, other community providers like Black and White and the ride shares need to work together collaboratively to provide a wide array of mobility options that are accessible and affordable to the entire community. That meet transportation needs someone on demand with flexible hours. There needs to be options that are 24 hours a day or close to it to accommodate people that have a variety of needs. There needs to be a variety of types of vehicles to accommodate last minute runs or runs with a single person. There needs to be access to regional transportation, and there needs to be a central entity to help coordinate all of it so that it is accessible to everyone.
Thank you so much. And I want to say thank you to you all. As a TARPS rider myself, you know, you all have brought up issues that I myself have faced, you know, on a day-to-day basis in using transportation to get to and from work and trying to, you know, access fun social activities in the community. It can be really, really difficult sometimes. So I'm glad that we have this community, and I'm hopeful that we can, you know, create a better transit system that works well for everybody in our Toledo, Northwest Ohio region. So thank you all for being here today and for sharing your stories. I really appreciate it. I'm going to pass it over to Katie, but thank you all again, and thank you for having me moderate.
Hello again, and I want to echo that. Thank you so much to all our panelists. I thought That was such a wonderful discussion about issues that are present in our community with public transit. Thank you to Katie, for stepping once to lead our panel, and nice job. And I appreciate you being here. At this point, we would open it up for audience questions. So if anybody has questions, there's a Q&A function at the bottom. We'll just give it a couple of minutes to see if people do. And we'd be happy to accept those. I am seeing something in the chat from Sean Smith that just says thank you for sharing your experiences. All right, I would like to thank everybody again for being here. This concludes our panel. We do have one session left in our ADA seminar this year. It starts at 2 o'clock. Again, there's still time to sign up if you haven't yet, to see our Community Partnership Award winner, the Area Office on Aging of Northwestern Ohio, present on their Transportation Navigator program. But otherwise, thank you to everyone for being here today. We look forward to seeing you again. Well, I am seeing one question. So we have a question from Kate Greenwell, and it says, what is your biggest positive about TARPs? Who would like to take that one? Go ahead, Lauren.
I am able to help people with communication disorders in my job because of TARPs. If I didn't have TARPs, I wouldn't be able to do what I'm doing now. And the working from home, although it was great going to work in my pajamas, that is not something that I would prefer to continue with. The face-to-face interaction is the heart of what I do. So access to that is only because of TARPs, and I am eternally grateful to them.
Wonderful, thank you. Anybody else? JoRita, you're on mute.
You're still on mute, JoRita.
There, I think I'm unmuted now.
Yes, you are.
I think the biggest positive about TARPs is its willingness to meet us where we are, and they have tried their best to accommodate where I wanted to go. And in fact, I used to have board meetings that were a little bit, just like a fourth of a mile or some minuscule amount past the I want to say interchange, but the interstate in Maumee, where they stop, they have taken me beyond that point and taken me to the church where I needed to go. So they do work with you if they can at all. And there was another occasion when I had been at Panera Bread at the mall, and when I left, and we had just left, and I realized I didn't have my cell phone with me. So the driver stopped, and he radioed dispatch and got permission to take me back to get my cell phone. And he even went in with me to look for it. And we did find it, but he didn't have to do that. He could have said, oh, well, you know, too bad, but he didn't. He tried his best to provide me with good customer service, and he did. I'm very grateful. So I'm looking forward to TARTA and TARPS being able to come out here when the issue 12 passes. And we've all got to work to make sure it does.
Excellent. And we do actually have to move on and end the session so we can be on time for our next one. But I appreciate those answers. I think, you know, what we hear from folks is that folks are very frustrated with the fact that transportation, the main frustration is that public transit is not available everywhere in our region. So we certainly look forward to hopefully being able to expand that as well. Thank you to everyone again for participating.
One moment.
And I hope to see everybody at our next session. Goodbye.
Thank you.